Okay. Hi, good morning, all of you. I am Harikala Thapa, and my student ID is 220705. Today I am going to represent the presentations about communication skills and strategies. Here is the content: communication skills and strategies. What is communication? Communication is we have to convey the message or informations, ideas, thought to others person. It's called communications, right? Here, according to my slides, here are two types of communication style: verbal communication and non-verbal communications. Verbal communications, it's here are the key elements of verbal communications: clarity and conciseness. It means we have to be clear in front of patients when we are going to counseling. For example, for clearness, we have to avoid the jargons. It's mean the medical terms, abbreviations. Patients or customers may not understand the abbreviations. And other thing is that we have to reduce or avoid the complex sentence. Like, for example, doctor prescribed the amlodipine, and if we are going to give the instructions like amlodipine helps to relax the blood vessels and increase the flow of blood, and it reduces the blood pressure. Instead of saying that, we can say this drug is this medicine is for your blood pressure, right? And then second, active listening. We have to face the customers with good eye contact. We have to show the interest towards them. And third is empathy and emotional intelligence. As a pharmacy technicians, we have to show the empathy. We have to show our kindness towards them. If we able to show that things, patient or customers will able or feel comfortable to share their all the conditions. Then it helps to get the better treatment outcomes, right? Then third is adaptability. For adaptability, we can, if the patient are not understand our what we are going to saying at that time, we can show them the visual things, visual aids, like that. And feedback and clarification. Feedback and clarifications during the summary time or counseling time, we can ask them the open-ended questions like, have you ever used these medicines before or not? If they are saying no, then we can give them the clear instructions. And it's a non-verbal communication strategies. These are the key elements: facial expression, gesture, posture, eye contact, and appearances. It's mean if the persons are not able to speaking or are not able to hearing very clearly, and if they are disabled, they can show the facial expressions like their happiness, the angerness. So we have to pursue ourselves in front of them according to these key elements, right? Then some importance of effective communications in healthcare team. Number one, enhance patient safety, accurate transfer of patient information, minimize the medications error, improves workflow efficiency, streamlined communications, reduce misunderstanding and delays, foster collaborative care, encourage teamwork and shared decision making. Fourth, builds trust and professional relationship. Open, respectful communication strengthens team dynamics. Communication strategies for disability people. Use clear and simple language. I showed you earlier, we have to use the clear and simple language. We have to avoid medical jargons and complex terms. We can use plain language that is easy to understand the every customers or every kinds of patients. Like if the patients are disabled, if they are elderly people, right? And incorporate visual aids and written materials. Use diagrams, pictures, or written instruction to explain how to take medications. Provide ample time for interaction. Give the person extra time to process information and respond without feeling rushed. It means, for example, even a normal person, some have a habits of active learning or learning very fast, or some have a very slow learning. Like in this case, if the people are disabled, they might not be react us on time. They need to have enough time to make the decisions or asking the questions like this. Then utilize alternative communication method. Adopt communication methods to meet the individual's needs, such as using sign language, communication boards, or electronic devices. So here, if the persons are not able to speaking good English language, or we are not able to understand to them, we can use electronic devices nowadays. It's very easy to use through Google's. That's it. Then communication for pharmacy technician in NZ sector. It's active listening. Ensure understanding of patient needs and concerns. Clear verbal communication. Reduce the risk of misunderstanding and medication errors. Empathy and compassion. Enhance patient satisfaction and adherence to treatment plans. Cultural competence. Importance of effectively communicating with a diverse patient populations. In New Zealand, we can find a lots of people coming from different countries. It's a diverse populations countries. That's why they have their own language, culture, traditions, and the language. So we have to try to acknowledge them according to their willings. That's it. Communications barriers in the New Zealand health sector. Cultural differences and language barriers. Diverse patient populations, language proficiency, and cultural sensitivity are the cause of cultural differences and language barriers. Health literacy, understanding medical information, access to information,